Hello friends, welcome back to my YouTube channel Hardik's Medical Science. Today we'll have a discussion on the heart failure. So, the first question is, what is heart failure? Heart failure is a condition where the heart pumps but not with the enough strength to meet body's demand for the oxygen and the blood. That means in heart failure, the heart is pumping but the blood is not reaching to all part of the body. What is the difference between the healthy heart and the heart with the heart failure? The major difference lies into the left ventricle. This is a normal healthy heart where you can see the left ventricle is sufficiently contracting, whereas with the heart in a heart failure, the muscles of a heart become weak, and because of a weakness into the muscles, you can see the left ventricle is not contracting sufficiently. Because of sufficient contraction into the normal heart, the heart is sending a sufficient amount of blood to the body, so whole body is receiving the blood. Where in case of the heart failure, because the heart is not pumping sufficiently, heart is sending insufficient blood to fulfill the need of the body. What are the signs and symptoms of the heart failure? How would you come to know that you are suffering from a heart failure? The first sign is the dizziness. Why a patient feel a dizziness or a fatigue during the heart failure? Because there is a low pressure developed within the body. Because of a low pressure, the brain is not receiving a sufficient amount of a blood, leads to the dizziness. The second sign is shortness of breath. In heart failure, it happens that there is a fluid accumulated within the lungs, leads to the shortness of breath. You are not breathing sufficiently. The third and an important symptom is the chest discomfort or a chest pain. Fourth is loss of appetite. The patient do not feel hungry. Last but not the least is the ankle swelling. A patient is having a swelling on the ankles. These are the signs and symptoms of a heart failure. Heart failure is also known as CHF or congestive heart failure. Why? Due to buildup of fluid in the three parts of the body. First, there is a fluid buildup into the lungs, which is known as pulmonary edema. Second, a fluid is built up within the stomach. And the third, the fluid is built up within the ankles. Why the heart failure develops? There are few causes, the reasons for development of the heart failure. The first, a chronic alcohol consumption or a chronic cocaine abuse. There is a disease in a valve conditions, like you have a problem with a tricuspid valve, a bicuspid valve, or a mitral valve, or any other valve of the heart. If a patient is having a coronary artery disease, that means previously a patient had a heart attack or angina pectoris. If a patient is suffering with a chronic high blood pressure, that is chronic hypertension. If a patient had a history of infections within the heart, or a patient is having a autoimmune disease conditions. These are the reasons or the causes for the heart failure. How would you differentiate the normal heart from a heart in a heart failure? What are the changes you observed in a heart in heart failure? One of the major change you will find is enlargement of a heart. Why do the heart is getting enlarged in the heart failure? As we discussed earlier, in heart failure, the muscles of a heart become very weak. To compensate that weakness, heart stretches itself more strongly to meet the body's demand of the blood. This causes the enlargement of a heart. Another change you will find is the increased muscle mass of the heart. Now you will see this is a normal heart where a muscle mass is limited, where in case of a diseased heart, a muscle mass increases. Again, why there is increase in a muscle mass? Just to compensate the weakness of a heart increases the muscles within it so that it can beat more strongly and send more blood into the body. Apart from the remodeling of a heart, there is a rapid heartbeat. In a heart failure, you will see the heart is pumping much faster to increase the cardiac output. What are the different types of the heart failure? Majorly, two types of the heart failure you will observe: HF-REF, HF-PEF. What is REF? Heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Let's understand this terminology. This is normal heart, where a healthy heart, you will see the ejection fraction is 55 to 70%. In case if you are having a HF-REF, that is heart failure with reduced ejection fraction, or a heart failure with a preserved ejection fraction, you will see the ejection fraction remains more than 50%, but a patient suffers from a heart failure. Where in case of reduced ejection fraction, the ejection fraction is reduced to less than 40% and the patient suffering from a heart failure. What is the difference between the reduced ejection fraction and preserved ejection fraction? The major difference you will find again in this area. You see, in case of a preserved ejection fraction, the walls of the heart become very thick, so a very little space is left with the left ventricle or a right ventricle. The walls become very thick and stiff. There is a little space where a blood can come in. Since the less amount of a blood come in, less amount of a blood goes out. This is heart failure with the preserved ejection fraction. With HF-REF, there is a sufficient space within the ventricle. In fact, the walls of the ventricle become very thin and at the same time weak. So, as you can see, in a normal heart, all the blood which is coming to the left ventricle on contraction, it is going out. But with reduced ejection fraction, the blood comes in, but all the blood do not goes out. This leads to less amount of a blood pumped out of the heart, leads to the heart failure with reduced ejection fraction. So importantly, we have to understand here what is ejection fraction. Ejection fraction, to understand the ejection fraction, you have to understand the two terminologies. One is stroke volume, another is end diastolic volume. What is stroke volume? Amount of a blood ejected from a ventricle with each heartbeat. How much amount of a blood is being pumped out with each heartbeat is known as stroke volume. Normally, a stroke volume is 70 ml. That means with each beat, heart is sending 70 ml blood into the body. What is end diastolic volume? After diastole of the heart, what amount of a blood is left out with the ventricle? That is end diastolic volume. Normally, end diastolic volume is 120 ml. So come to the important question. What is ejection fraction? Ejection fraction is SV by EDV. That means 70 ml divided by 120 ml. That comes to 58%. So normal ejection fraction is somewhere between 50% to 70%. If your ejection fraction reduces to less than 40%, it leads to HFrEF, that is heart failure with reduced ejection fraction. What are the different treatment options for the heart failure? There are very limited treatment options for the heart failure. For the preserved ejection fraction, heart failure with the preserved ejection fraction, very limited therapies are available. For the heart failure with the reduced ejection fraction, few therapies are available. The most important and the approved therapy for the heart failure in reduced ejection fraction is ARNI. ARNI stands for angiotensin receptor neprilysin inhibitor. That's a combination of sacubitril plus valsartan. Another important therapy which you will find in all the patients of a heart failure is beta blockers like metoprolol or bisoprolol. The third is MRA. MRA stands for mineralocorticoid receptor antagonist like spironolactone. The fourth